Hi, everyone. So, now we're going to talk about some of the more common discomforts that you can experience in pregnancy. Your body does some weird and wonderful things as you are growing your little person, and it's not always the most comfortable. So, I'm going to talk about what's going on in your body physiologically and what you can do about it. So, I'm going to talk a lot about a hormone called progesterone. It's released by your placenta, and its role really is to relax and dilate a whole bunch of things in your body to accommodate your growing fetus. So, what it does with vasodilation, which is the dilation of your blood vessels, it's to allow your blood volume to increase as it does substantially in pregnancy. But it can also cause headaches. It can cause sinus congestion, and that can be pretty uncomfortable. So, some things that I want you to do if you're experiencing headaches, I want you to review potential triggers in your diet and cut them out if you need to. Some preventative measures you can do are eating well, eating regularly, and hydration. Hydration is a very big one when you are pregnant. I also want you to be well rested and introduce some exercise into your life as well, okay? Relaxation techniques are great: massage, bath, warm bean bags, acupuncture, aromatherapy. And then to relieve congestion, you can use a little bit of steam, a saline rinse from a neti pot, hydration, and patience. If you decide you want to take some medication, you can take Tylenol. Some safe over-the-counter antihistamines include Claritin and Benadryl. You can also use topical sinus relief nasal sprays. Those are safe to take in pregnancy. If you do have an onset of a severe headache with visual disturbances, so seeing stars, for example, pain underneath your ribs, excessive swelling in your hands or your feet, a rapid heartbeat, dizziness, nausea, and vomiting, please page your midwife. That has the potential to be more complicated than just a headache, and we would want to talk with you. So, other things that can happen are dizziness and fainting. So, this can happen because of low blood sugar, low iron, low blood pressure. Some non pharmacological remedies include eating small, frequent meals, up your protein, increase your dietary iron or your iron supplementation, increase your hydration, get up slowly from sitting or lying down. And if you do feel dizzy, take some deep breaths, sit down, put your head between your knees if possible, and contact your midwife if you have a fall or if symptoms persist, and they may offer you some blood work. Heartburn is another one that comes up. It's a little bit more common later on in pregnancy as your belly grows and puts more pressure on your stomach, but it can happen at any point during pregnancy. What happens here is that progesterone relaxes your esophageal sphincter, and it just makes it a little bit easier for the contents of your stomach to splash up into that area of your body and cause some irritation. So some non-pharmacological things that you can do include eating small, frequent meals. Don't wash your food down with water. Try drinking liquid half an hour before or half an hour after you eat. Sleep propped up in a semi-sitting position. That's just getting gravity to help you with things. And avoid triggering foods like spice, chocolate, and caffeine. If you decide you would like to take some drugs to help you with your heartburn, antacids that are safe in pregnancy include proton pump inhibitors like Nexium, histamine antagonists like Pepcid, and magnesium, calcium, and aluminum-based antacids like Tums. It's not recommended to take antacids containing bicarbonate when you are pregnant. So check out the mother-to-baby fact sheets or talk to your midwife if you have a question about a medication. Back pain is another really common one. So what happens here is you get some loosening and shifting of the pelvic ligaments resulting from hormonal changes, namely progesterone. Lordosis also occurs, which is an increase in the curvature of your spine, and that is associated with a change in the center of gravity from your growing belly. So some non-pharmacological things you can do: warm baths, paying close attention to body mechanics when lifting, bending, doing regular activities. Chiropractor adjustments are great. Massage is great. Physiotherapy is great. You can use support belts or physiotherapy tape. Tylenol is, of course, always there if you do end up needing it. Kind of coupled with back pain is pelvic pain. So I find that this typically occurs in two main areas. The first one being round ligaments. So these ligaments connect your uterus to your groin. And when your uterus is tiny and tucked under your pubic bone, they don't have to do much stretching. But as your uterus grows, they stretch quite a lot. You can really irritate these ligaments if you're not careful how you move. So, for example, as you get increasingly pregnant, it's very common to want to swing one leg out when you're getting out of bed, and then swing your belly, and then swing your other leg. You also do this when getting in and out of cars, and that's just as you're trying to deal with the different way you have to move your center of gravity. However, when you do that, you are stretching those ligaments. So instead of doing those big movements to get out of those situations, what I want you to do is go back to the late 90s or the early 2000s. I don't remember when this episode aired. And just think about Ross from Friends behind you yelling pivot at you as you kind of twist out of your car or out of bed, okay? Take your legs with you. Keep your body line in one direction and protect those ligaments. You can also use a belt or scarf to provide support and stabilize your pubic area. Another area where people get a lot of discomfort is actually at the joint of the pubic symphysis, which is the joint right at the front of your pelvis, above your external genitalia. And sometimes people feel this relaxed enough that they feel their pelvic bone shift a little bit, which can be quite uncomfortable. So again, that pregnancy belt to provide support if you are experiencing this. Changing position slowly, sitting up, standing, and twisting. Pay very close attention to your body mechanics here. All right, so nausea and vomiting, the most well known of the pregnancy discomforts. This is typically experienced by people in the first trimester, and then it does get better for most, although for some people, it stays with them throughout a good chunk of their pregnancy. And for other people, it comes back later on in their pregnancy because it is triggered by heartburn, for example. So what happens typically here is progesterone added again slows the passing of food through your gastrointestinal tract. And this can actually make you feel nauseous from low blood sugar. So some non-pharmacological remedies. Discontinue your prenatal vitamins if that's what's triggering you. You can actually break them down into individual supplements. It's a lot more pills, but sometimes it's a little bit more gentle on your stomach as you're getting through that initial period in your pregnancy. Review your diet to identify trigger foods. Avoid spicy, acidic, or greasy foods, for example. Those can sometimes cause you to be nauseous or vomit. Ginger tea, peppermint tea, those are all really good at helping. Eat small and frequent meals. Eat something plain before you put your feet on the floor getting out of bed in the morning. Crackers, dry cereal, etc. What that really is aiming to do is to keep your blood sugar even by giving you something little just to keep it going throughout the day. Stay hydrated, really important, and well rested. If you find that you're being triggered by even just the smell of foods, try smelling a lemon. Sometimes that can actually help you get through that trigger. Some pharmacological remedies, if you would like to take some drugs to help you out here. You can take Gravol very safely in pregnancy, so you can take 50 to 100 milligrams of Gravol by mouth, normal, regular Gravol. You don't have to do the ginger chew Gravol. You can take the real diamond hydronate drug every 4 to 6 hours. It'll make you feel groggy, but it might also give you a nap, which would be nice. If your nausea and vomiting is severe and you can't keep anything down, Gravol is available as a rectal suppository, so you can try that. If your nausea and vomiting is severe and is persistently severe, please let your midwife know. There is a drug that we can prescribe called diclectin, which is a combination of an antihistamine and vitamin B6, which can help with nausea and vomiting, and you take that a couple of times throughout the day. If you really can't keep anything down at all and you start losing weight, your midwife really does need to know about that because you might need IV hydration, for example, and other things to help you control your nausea. So just keep your midwife up to date with what's going on with you. Constipation is another side of a slowing of food through your digestive tract caused by progesterone. So, increasing your hydration and increasing your daily fiber are going to be the two main things that are going to help you through constipation in pregnancy. Regular exercise is also very helpful. You can take a fiber supplementation like Metamucil. If you're taking iron supplements, you can adjust them slightly because iron can cause you to be constipated. Other foods that can really help increase gastrointestinal motility are like papaya and pineapple, for example. Those two are really great. Try drinking some lemon water. That also helps. So, swollen feet and ankles next. So, what happens here is you get, with your increased blood volume and your dilation of your blood vessels, this results in decreased blood return from your extremities, like your legs, to your central body. Your gravid uterus, so your pregnant uterus, also compresses the veins in the pelvic area. And kind of keeps congestion in your legs. So, this results in swelling of the tissues in your lower extremities. This often happens later in pregnancy. As you can imagine, when your uterus gets bigger, it impedes that venous blood flow even more. This can also happen in the first couple of days postpartum, really commonly. So, some non pharmacological things you can do: reduce your salt intake, because that will reduce water retention. It is still important to keep hydrated. Keep everything flushing through well. Elevate your feet. Rest with them up. You can put a pillow underneath them as you sleep at night. Swimming is really great if you have access to a pool. It actually can help equalize pressure and redistribute water around your body. With the relaxation of your ligaments in the rest of your body, you also get relaxation in the ligaments in your feet. Unfortunately, as we walk around on our feet all the time, they do not always have the chance to come back entirely to their pre-pregnancy size in the postpartum, and they can remain stretched out a little bit. So while the swelling will go down, this is why sometimes people say that their foot size increases after pregnancy. Another one is shortness of breath. So this is one that you'll hear pregnant people talk about quite a lot. So what happens is progesterone, add it again here, in order to facilitate the expulsion of gas produced by your baby, you have to breathe more and often deeper and faster than you are used to. Your growing uterus also starts to put pressure on your lungs from underneath. Luckily, the ligaments in your ribs relax to allow you to breathe more outwards than downwards. However, it is not as satisfying as taking a big, deep, non-pregnant breath. Shortness of breath in pregnancy is a common discomfort. However, if your shortness of breath comes on suddenly or is associated with dizziness or pain, please contact your midwife. Some things you can do: take a breather for a bit, literally. Relax and move slowly. Try to maintain good posture to give your lungs the space they deserve. Trouble sleeping is my next one. So, hormone cycles during pregnancy affect your circadian rhythms. Frequently, people report trouble sleeping between the hours of 3 and 5 a.m. when a couple of hormones like prolactin spike. Some non pharmacological things you can do are really just accept your body's current hormonal cycles. It's normal. Don't try to fight it. Try not to feel frustrated, resentful, or dismayed. Accepting it can make a difference in mentality and actually how tired you feel. Compensate with naps if at all possible, and do not feel guilty about taking them. And when you're awake in the middle of the night, take the time to do quiet things. Have a little ritual. Make yourself a cup of your favorite non-caffeinated tea. Don't put on your computer, your TV, or your phone, because blue light can actually make you stay awake for longer. Do some meditation or read a chapter of your favorite book. Have a set rhythm where you do something for a certain amount of time, then you put it away and you put yourself back to bed again. And hopefully that gets you a little bit more sleep. So, muscle cramps are an involuntary contraction of a muscle resulting in a sharp pain. They can be caused by dehydration, pregnancy-associated changes in blood flow, overuse, nerve compression like sciatica, or lack of minerals. So sometimes people get them in their legs, sometimes people get them in their uterus, and they are tricky. They're not comfortable. So, some non pharmacological things you can do, including stretching or massaging the affected muscle, heat or cold therapy for relief, a bath with or without Epsom salts, increase your hydration is a really big one here. And incorporating potassium rich foods in your diet, like bananas, kiwi, and cantaloupe. Those can also help with muscle cramping. If you would like to help yourself along with some supplementation, um, you can try potassium, magnesium, and calcium. Those can help with muscle cramps. Carpal tunnel syndrome is something that also happens with swelling in pregnancy. So, what this is it's kind of a painful, numb sensation, classically in your thumb and your first finger here. So, what happens is you get swelling in your wrist, just like how we talked about earlier, you get swelling in your feet. It can also happen in the extremities of your hands. And as you get swelling in your wrist, it actually compresses the median nerve, which innervates this area of your hand. And pregnant people are more susceptible to carpal syndrome because of fluid retention, especially in the third trimester. So this usually resolves at the end of pregnancy, but unfortunately it is likely to recur with subsequent pregnancies. What you can do is elevate your wrist and splint it to keep it straight during the night. I don't know about you guys, but sleeping like this, if anybody does that, will not help with carpal tunnel syndrome. So keeping that wrist really nice and straight will. And go swimming, like we talked about with swelling. That can help as well. Sometimes people have luck with acupuncture. I've heard that. My last one that I have here is polymorphic eruption of pregnancy. This used to be known by pruritic eudocardial papules and plaques of pregnancy, or PUPS, PUPPS. And it's one of the most common rashes that people get in pregnancy. So this occurs most commonly in people having their first baby or people carrying more than one baby, and it typically presents as a striped rash that can spread from your core to your extremities. Usually your face, your palms, and the soles of your feet are not affected. Typically, this begins late in the third trimester with a mean onset of about 35 weeks gestational age, but it can develop postpartum. It generally resolves about 4 weeks after you've had your baby, although it may last longer. The cause of PUPS is unknown, but it is not associated with an increased risk to the parent or the baby. You can treat it with over-the-counter creams to relieve symptoms. Topical corticosteroids and oral antihistamines can be used. If your rash is in circles around your belly button, or your hands and feet are super itchy without a rash, this is likely not PUPS, and please let your midwife know. All right, everyone, so those are the most common discomforts in pregnancy that my clients ask me about. Of course, if you have concerns and you feel like you need to be assessed, you need to talk to your midwife, please page them or email them if you need more information about what's going on with your body and it's not an emergency.